Hello, good morning, good afternoon, good evening, wherever you're watching me from. Thank you so much for coming around to this live stream. Joyous Joyce Uzoma, thank you so much for coming around. Everyday Matters, thank you so much for coming around. Thank you for coming around. I've been here all this while. Happy weekend to you and to your family. Happy weekend to you. Yes. Greetings and happy weekend to you. Happy weekend to everyone coming around. We are coming across my channel for the very first time. You are welcome to Elder Living with Deborah. You're welcome to Elder Living with Deborah. Thank you so much for coming around. So, yeah, we've taken time to talk about infertility, and of recent I uploaded videos on foods that could help to boost fertility in both men and women. And eventually last week I streamlined to the causes of, all right, thank you, everyday matters. I streamlined to the causes of infertility in men. So I mentioned some things that could subject a man to being infertile, like low sperm count, low motility of the sperm, abnormal shape of the sperm, to mention but a few, ejaculatory disorders to mention but a few. So today I'm going to, a lot of things could actually lead to infertility, and let me start all over again by saying that infertility is the absence of conception. All right, thank you. Is the absence of conception after 6 months or 12 months of, regular intercourse without contraceptives. So a lot of things could actually subject the woman or the man to infertility. Yeah, everyday matters. Some people have been just disturbing me at the background, disturbing me from the background. Okay, so today I'm going to be talking about those medications and the lifestyle, yes, lifestyle habits that could actually result into infertility in men. Yes, this girl. Thank you for the understanding. Okay, so let's start with what are those drugs. A lot of people just go to the counter, buy this drug, buy that drug, not even knowing that that drug can actually impair their health. It could have a negative effect, yes, a negative effect on their health. So is one of the major cause of 1/3 cases of infertility in men. So when you say, oh, this man is infertile, most of the times it is always, not all of them, but most of them, it is always low sperm count. So today, now, when I say low sperm count, the semen of a man contains, fluids, contains sperm, and low sperm count means that the fluid, that is the semen of that a man ejaculates during orgasm, contains fewer sperm than normal. You understand what I'm saying now? And it is also called oligospermia. So when it contains fewer sperm, and if it doesn't even, if it is just normal fluid, no sperm at all, that is even azoospermia. That is even azoospermia. So what are the examples of these drugs? What are these lifestyle, you know habits that could subject a man to having low sperm count? Okay, so let's start right away. Number one is anabolic steroids. Anabolic steroids. So as others come in, they'll be joining us. Number one is actually anabolic steroid. Now, this is usually popular with bodybuilders and those into athletics. Yes, so and the long-term use of these anabolic steroids could have a lot of negative effects on the body. So it is actually used to build the body. These people that engage in athletics, bodybuilders, they want to build their body, build their muscles, and then some of them end up taking anabolic steroids. Now, the long-term use can seriously reduce sperm count and increase the risk of infertility. and movement of sperm, which is the motility of the sperm. Thank you so much for coming in. Early Years Matters TV. Happy weekend to you and your family. So number one drug and lifestyle habit is anabolic steroids. Like I said, it's popular with bodybuilders and those into athletics. Why do they take it then? Yeah, because they want to be on top of their profession. They want to carry first in all their competitions. Someone is asking, so why do they take it when they know that it has a lot of negative effects, and it's always the long-term use. When you are just starting something and you do away with it, fine, you may not get to, experience the negative effects, but when you become used to it, you always want your muscle to, then it can cause the testicles to begin to shrink and sperm production begins to reduce. Don't forget that the sperms are produced in the testicles. So when the testicles begin to shrink, the production of sperm begins to decrease, which could result into low sperm counts. You even see some of them having big breasts. Yes, some of them is because of this anabolic steroids. It results into breast enlargement, and this seriously reduces sperm count and motility of sperm. Okay, so examples are oxandrine, Winstrol, Anadrol, anabolic. All these are examples of anabolic steroids. Thank you for coming in. Eddie, yes, Joyous Joy. Thank you, everyone, for staying and coming and staying in the chat. Okay, so number two is illegal drugs. Illegal drugs. Now, this time I'm talking about cocaine and marijuana. Cocaine, marijuana, these are good examples of illegal drugs. They may temporarily reduce the number and the quality of the sperm. Hence, they can lower the sperm count. So when you see a man always taking marijuana, taking cocaine, such a man is reducing his chances of giving birth. You understand? Because, hey, Ujunwa Chinwe, thank you for coming around. Happy weekend to you, Ujunwa Chinwe, and to your family. Okay, so we are talking about drugs and, lifestyle habits that could result into low sperm count. Good afternoon, everyone in the house. Thank you for coming around. So number one is long-term use of anabolic steroids. And number two is illegal drugs, use of illegal drugs such as marijuana and cocaine. Hey, Yangas in Dubai, thank you for coming around. Thank you, everyone, for the amazing thumbs up. Thank you for coming around. Happy weekend to you and family. How is Dubai today? So number two is illegal drugs, cocaine and marijuana. And like I said, they may temporarily reduce the number and the quality of the sperm of the man, and that could result into low sperm counts. Number three is excess alcohol consumption. Now, when it comes to alcohol, a lot of people have different, ideologies, different mindsets. Somebody will say, oh, but that man has been taking alcohol all this while. He has 5 kids. That one doesn't even take alcohol. He doesn't have one or he doesn't have two. So when it comes to alcohol, the basis of the matter is that alcohol is dangerous to the entire body. When I say the entire body, I mean to the entire system. I'm talking about excess alcohol consumption. It can lower the testosterone levels. Now, there are major hormones in the man, there are major hormones in the woman that are involved in reproduction. For example, in the woman, we have the luteinizing hormone, we have the follicle stimulating hormone, we have the prolactin. These are examples of hormone in women. And if any or all these hormones, they have range in the body. Yomiti Oluwaseun. Hey, thank you so much for coming around. Yomiti Oluwaseun. I just hope I recollect the person. Thank you so much for coming around. Happy weekend to you. Happy weekend to you. Okay, so alcohol can lower testosterone levels. Testosterone is one of the hormones in men when it comes to reproduction. So testosterone level can be lowered by alcohol. It could cause erectile dysfunction. Yes, the stick is not able to stand properly. It could cause erectile dysfunction. It could also decrease sperm production and result into liver disease. And liver disease, on the other hand, could lead to fertility problems. So when you see a man always drinking alcohol, the very first thing that person is inviting is liver disease. And when the liver breaks down, then before you know it, every other system begins to collapse, because the liver helps to detoxify toxic substances in the blood. And when the liver breaks down, then what happens? The toxic substances, how are they excreted from the body? You understand? So excess alcohol consumption is very, very dangerous for the entire body, and unfortunately it plays a vital role in infertility. Number 4 is some arthritis drugs. You just go to the chemist and you say, I want to take over-the-counter drugs. Over-the-counter drugs. Does that mean no alcohol at all? There is one thing about alcohol, everyday matters. A lot of people that take alcohol, they end up binging. And some people will tell you, oh, I don't take it regularly, I just take it once in a while, fine for them. But most people end up binging, they end up getting used to it, addicted to it, and then before you know it, they can't actually survive without alcohol. So the best thing when it comes to alcohol, the best thing is just to stay away from it, so as not to get addicted to it, so as not to end up binging. And the same thing goes for all these illegal drugs too, cocaine and marijuana. When people start taking it, before you know it, it's like, oh, I'm enjoying it, and then they get used to it and they can't survive without it. Okay, so let's go to number 4. Number 4 is some arthritis drugs. Some arthritis drugs. Yes, like I was saying, that is one of the reasons why it's not good to just go and take over-the-counter drugs. Over-the-counter drugs. Now, anti-inflammatory drugs like sulfasalazine. No, just just don't pay attention to the name. So anti-inflammatory drugs like sulfasalazine can significantly lower a man's sperm count, and it is often prescribed for rheumatoid arthritis. Now, however, the sperm count often returns to the normal after stopping the drugs. But while a man is taking this kind of a drug, the sperm count of that man could reduce. And I don't even think in the first place this kind of a drug should be prescribed for a man that is having issues with infertility. Okay, so some arthritis drugs could also lower the sperm count of a man. And number 5 is mental stress. Yes, when a man is stressed, when a woman is stressed, some hormones are released, stress hormones are released. And the impact of these hormones, yes, self-medication is very bad, yes. And the impact of these hormones, some of them is so dangerous for the body, you understand. So when mental stress, especially when it leads to reduced sexual activity, stress, when a man is overstressed, when a woman is overstressed, too much of stress hormones are released. They travel through the bloodstream, they get to the reproductive system, and then they begin to tamper with the whole reproduction process. So number 6 is something we should really pay attention to, which is mental stress. Mental stress. So don't stress your husband too much. Number 6 is tobacco. Yeah, tobacco. Now, generally, men who smoke have a lower sperm count compared to those that don't smoke at all. So this brings us back to cocaine, marijuana, alcohol, smoking. This again is tobacco. So men who smoke have a lower sperm count than those who don't smoke. And second-hand smoking is not left out. I've taken time to talk about second-hand smoking, sometimes ago. Yes, stress affects both men and women. That is just it. It's not only men alone. Stress affects both men and women, because whether it is the man or the woman that is stressed, the stress hormones are released, and then they begin to tamper with the whole reproduction process. So stress cuts across both male and female. Yes, after this episode, we are going to be having a live stream, and we'll be talking about the causes of infertility in women. Yes, and I'm very sure that stress will also come in when we are talking about the female folks. So like I was saying, tobacco, secondhand smoke is also dangerous. Yes, and I have explained what is it. When you are living with someone that is always smoking, don't say, oh, I'm not the one smoking, it's just my friend, it's just my husband, it's just my cousin. No, you are always there when the person is smoking. You are also a smoker. Yeah, you are also a smoker. The only thing is that you are not the one lighting the tobacco. So you are not the primary smoker, you are the secondary smoker. So when you have someone, you live in the same house, always smoking, smoking and smoking, you got to talk to that person to stop smoking. Yes, wow, I never knew this before. Yeah, that's just it. Ujunwa Chinwe. Smoking goes for both males and females too. Don't just smoke, or you live with someone that is always smoking and you say, oh, I'm not the one smoking. You are inhaling the nicotine together. You are inhaling the nicotine too. So the person is also a smoker. When a man is smoking, it's also reducing his chance of fertility. Number 7 is obesity. Obesity, yes. Obesity can impair fertility in several ways. Several ways. Now, obesity is when somebody has eaten and eaten, and the person has stored so much excess fat in the body. And when you take your carbohydrates, it's broken down, stored in form of glucose. Before you know, it's stored as fats. Then the same thing goes for your fat and oil. I just hope my network is all right. I hope my network is not fumbling. Okay, so obesity, when somebody has eaten and eaten and the person is just big, obesity can impair fertility in several ways, including directly impacting the sperm themselves, yes, at the same time causing hormone changes that could reduce male fertility. So that means that obesity could result into hormonal changes, and it could also directly impair someone's fertility. And at the same time, don't forget that someone who is obese could, end up developing diabetes too, especially if the person is always eating sugary foods, carbohydrates, sugary foods, fast foods. Such a person could develop diabetes too, and I'm coming to diabetes. Okay, so that is obesity. And number 7, okay, number 8 is hormonal imbalance. Yes, hormonal imbalance, when there's an imbalance in the hormone of the person, like low testosterone, like disorder of the testicles. Maybe the testicles are not well descended. Now, the testicles are those two organs in the outside of a man. When you see a man, those two organs in the outside, and it needs a cooler temperature. That is why it is outside. So when the testicles are not well descended, where there's any disorder with the testicles, when there's low testosterone, hormones that are involved in reproduction, it could also result into low sperm count, infertility in men. And the very next point is radiation or X-ray. Radiation or X-ray. Yes, exposure to radiation can reduce sperm production. When a man is overexposed to radiation, it could also have a negative effect, on the sperm. And though it may often return to normal with high doses of radiation, sperm production can be permanently reduced. Can you hear that? So when a man is always going for X-ray, going for radiation, this X-ray, that X-ray, especially if the X-ray is towards his reproductive system, then it could actually reduce sperm production. And like I said, it may return back to normal, but when radiation becomes too much, when there's high dose of radiation, sperm production could be permanently reduced. Yeah, permanently reduced. Now, another thing is overexposure to certain environmental elements. Yes, I just hope I'm not too fast. I hope I'm not too fast. Please let me know if I'm too fast. Yeah, I don't think this live stream will be as long as usual. Okay, so just trying to be as concise as possible so that those who would like to watch the repeat broadcast will take their time and watch it to the end. You understand? So I'm trying to be as precise and as concise as possible. Thank you for staying in the chat. Thank you, everyone. Okay, so overexposure to certain environmental elements such as heat. I already mentioned overheated surfaces when I was, in my last video. Please, if you are yet to watch that video, kindly watch. This is just like the part two of that video. So I mentioned overheated testicles. When a man is fond of wearing tight clothes, tight trousers, tight pants, tight boxers, everything is just tight. There's something they call pant trousers. It's so tight. So when a man goes to work in the morning, wears that kind of a thing, your office is very hot, you are wearing something very tight, and you come back home, the house is hot again, heat. All these things make the testicles to be hot, and when the testicle is hot, it won't perform as it ought to be over time. So it's creating a potential damage on the man. So it's another thing is toxins and chemicals can reduce sperm production or function. There are chemicals, there are, yes, what about people that live in really, that is why even when one lives in a really hot climate, then you've got to select your clothing very well. Thank you for coming around, fantastic Afe. Happy weekend to you and your family. How is Spain today? Fantastic Afe. Yes, what about people that really live in hot climate? And people that live in hot climates, they are not expected at all to wear tight trousers. That is what I'm saying. When you go to work, come back, put off your trousers and look for something lighter. For those who live in hot climates, you are expected to wear something lighter. You understand? Even the trousers, like if the place is so hot, like there's this part of Nigeria called Sokoto, Kaduna, all those places are very hot. So the materials the men should be wearing in that place should not be something so thick. Yes, should not be something so thick. And even when a man comes back home, try to wear something light. You are in your house, okay? Try to be as free as possible. I'm not saying the man should be naked, but be as free as possible. You don't want to get your testicles overheated. Okay, so another thing is toxins. There are some toxins and chemicals that can reduce sperm production and function in men. For example, industrial chemicals like pesticides, like herbicides, like organic solvents, even exposure to lead or other heavy chemicals. So fantastic Efe, I'm talking about drugs and lifestyle habits that could result into low sperm count, infertility generally in men. And my number one was anabolic steroids. I said most of the time it is taken by bodybuilders, those into athletics. They want to develop their muscles, they want, to develop muscle mass, muscle strength, and then they end up using these drugs. And these drugs can result into low sperm count, breast enlargement, reduce their sperm production. And for example, I mentioned oxandrine, withdrawal, and withdrawal. Okay. And my number two was illegal drugs such as cocaine and marijuana. These two things can reduce the number and the quality of the sperm of a man and result into low sperm count. Number three is excess alcohol consumption. Excess alcohol consumption could also result into low sperm count. Number four is some arthritis drugs, and that brings us to the fact that over the counter, we should just go over the counter and take drugs and say, oh, I just need that drug, I need that drug. No, over the counter drugs, try as much as possible to check up with your doctor before taking such drugs. Number five is mental stress. When a man is stressed, when a woman is stressed, the stress hormones are released. The stress hormones are released, and before you know it, they begin to interact with the whole reproduction process, production of sperm in the man. And my number six was tobacco. Yes, tobacco may also lower sperm count, and secondhand smoking is also really dangerous. And my number seven was obesity. Yes, obesity, overweight, you've accumulated so much fat, so much sugar in the body. This could also result into low sperm count. It could also, cause hormonal changes, changes in the hormones that have to do with male fertility. And that takes us to hormonal imbalance. I said a man could have low testosterone, disorder of the testicles, to mention but a few. Thank you so much. Thank you, fantastic Efe. Thank you, everyone that has shared me out. Thank you so much for sharing me out. So I mentioned exposure to radiation. Yes, that was where I was before fantastic Efe came in. So exposure to radiations can reduce sperm production. Overexposure to certain environmental elements, like I mentioned heat, like I mentioned pesticides, herbicides, organic solvents. Overexposure to lead or other heavy chemicals could result into infertility. And that takes us to a major point, a very critical point, which is generally medical conditions. Now I'm coming to medical conditions. So medical conditions like testicular infection, infection of the testicles, okay, testicular infection, cancer, cancer or surgery. You understand what I'm saying? Now, cancer and non-malignant tumors can affect the male reproductive organs directly. Yeah, cancer can affect the male reproductive organs directly through the glands that release hormones that are related to reproduction. You understand? So cancer is another thing that could result into male infertility, such as the pituitary gland. So cancer cells are very dangerous. Non-malignant tumors, cancer could also result into infertility. At the same time, even the chemotherapy itself, that's so unfortunate. Even while trying to kill the cancer, in some cases surgery, radiation, like I said the other time, or chemotherapy to treat cancer, to treat tumors, can also affect male fertility. Yes, especially where the surgery is being carried out. You understand? Especially where the surgery is being carried out. Some types of chemotherapy may significantly reduce sperm count. That's just the truth. Some types of chemotherapy may significantly reduce sperm count. So testicular infections, infection in the testicles. Testicles are where the sperms are being formed, being produced. So testicular infection, cancer, surgery, all these could also contribute to low sperm count, infertility in men. Yes, and when the glands that release hormones that have to do with reproduction are being tampered with, yes, when they are being tampered with, this could also result into infertility, like the adrenal gland, okay. So that is it for the medical conditions. Another thing is testosterone replacement therapy. Testosterone replacement testosterone replacement therapy, okay. All these could result into infertility in men. So there was something, what of women? Yes, next week I should be taking that of women. Yes, women, everything about women is always special. Women is so diversified, so it's not something we can combine with men, okay. Ujunwa is asking what of women, so we're going to be taking women. That should be next week, okay. We're going to be taking women. That should be next week. So like I said the other time, it's just a pity that BB Physio Food is not around. So when I uploaded the video during the week, that was actually the part one of this video, what could actually cause infertility in men. I mentioned something. I mentioned ejaculatory disorder, and BB Physio Food, I went through my comment section and I saw a question. She asked what could actually cause ejaculatory disorder. So I decided to come and answer the question on a live stream, should in case one or two people are also having that question in mind. Maybe BB Physio will come around. Maybe BB Physio will come around before the end of the live stream, and if she does it, maybe she will catch up with a repeat broadcast. So when we say ejaculatory disorder, is a kind of a retrograde ejaculation that occurs when the semen enters into the bladder during orgasm. So when a man is having intercourse, the semen is coming out and it's kind of diverts into the bladder. The bladder is where urine is being stored. So instead of emerging to the tip of the pole from where it will, be inserted into the woman, by the time it is meant to go into the pole, it diverts, kind of a diversion into the bladder of the man instead of entering into the tip of the genital organ of the man. That is retrograde ejaculation. That is a disorder. That is an ejaculatory disorder. And what could result into this? The sperm is just going, and all of a sudden it diverts. So that the causes include number one, diabetes. And that answers your question, everyday matter. Say, what about men that eat too much sugar? So that is it. One of the causes of retrograde ejaculatory disorder is diabetes. And we know what diabetes means. When there's so much glucose in circulation in the blood, when a man eats too much sugar, too much sugary foods, in the morning is poundo yam, in the afternoon is white rice, in the night is semovita, the following day is poundo yam, is rice, is fast food, is gelato, is sugar, everything sugar. And before you know it, hey, it's even always better for men, because some of them end up burning the sugar. But it's more critical for females, because a lot of us don't end up burning up all the sugars, and some of them are stored in the bloodstream. Okay, so yeah, so one major cause of retrograde ejaculation is diabetes. Like I said, too much sugar, too much sugary foods could result into diabetes. That hormone insulin, when it is released, the excess sugar are meant to be picked up by the cells in the body. But when the hormones become tired, weak, they freak out. Knowing the insulin, enough insulin is not released to pick up the excess glucose in circulation, diabetes could set in. So diabetes could result into retrograde ejaculation. Another thing is spinal injuries. Yes, injury to the spine, surgery. I already mentioned surgery the other time. Surgery of the bladder, for example. The bladder is where urine is being stored, whether in the male or in the female. Surgery of the bladder, for example, could result into retrograde ejaculation. Prostate or urethra, surgery of the prostate to surgery of the urethra. Another thing is injury from surgery. Yes, maybe someone undergoes surgery of the prostate, surgery of the bladder, and there's an injury. It could also result into retrograde ejaculation. And infections too. I said it the last time, testicular infections, abnormal development of the testicles. Maybe the testicles are not well formed, well shaped. Okay, this could also result into retrograde ejaculation. And instead of the sperm, the semen, the sperm is in the semen. Instead of the semen to come out this way, it goes back the other way. It goes back the other way. Now, let me quickly point that there should be enough sperm in the semen of a man. Yes, that is what is called sperm count. There should be enough sperm. If the semen is just there and it's just water, there's no sperm there, that's a problem. That's azoospermia, like I said when I started. It's going to be a big problem. Okay, hello from London. Thumbs up for the amazing hours. Okay. Thank you for coming around, Super Boss Keck TV. Thank you for coming around. Happy weekend to you. Yes, you've been showing us a lot of beautiful streets in London. I've been watching your videos, see those beautiful streets in London. Thank you for coming around. Now, a low sperm count is when the sperm count of a man is fewer than 15 million per milliliter of semen. When the sperm count is fewer than 15 million per milliliter of semen, or fewer than 39 millions per ejaculate. Can you see that? Oh, it's not easy to give birth to. It's not easy to fertilize a child. When you are needing 15 million per milliliter of semen, you are needing 39 million. Mamma mia. Yeah, thank you so much, Yomiti. Thank you. Very educative. Really love this. Thank you, Yomiti Oluwaseun. I this person should be someone I know. For now, I can't really lay my hands on the person. I can't really lay my hands on the person, but this should be someone I know. Okay, so that's just it. Oh. Yes, that's right. Thanks. Yeah, it's no reproduction is so much work. Reproduction is so much work, and that is why when God gives you breakthrough and you have the child, you need to take good care of that child. Reproduction is so much work. So our low sperm count is fewer than 50 millions per milliliter of semen, or fewer than 39 millions per ejaculate. So that's just it. And that takes us to number 12. Number 12 is antibodies that attack sperm. Yes, there are, oh, did I just there are some of these antibodies in the body that attack the sperm. Yes, like anti-sperm antibodies, anti-sperm antibodies. They are immune system cells. They are in the body, you understand, and they mistakenly identify sperm as harmful invaders. So when they mistakenly identify them as harmful invaders, they start thinking of how to get rid of them. They start making attempts to eliminate them. That is antibodies that attack sperm. And that is why when a man is having issues with fertility, it's not something you just keep to yourself and you say, I'll be praying, I'll be praying. It's good to pray. Yeah, I'm not disputing the place of faith, but you need to reach out to your doctor. 1 year, 2 year, 3 years, you are there, you are saying, I'll be praying, I'll be praying. You've got to rise up and go to your doctor and check up. You understand? Maybe you even have antibodies that are killing the sperm. The man doesn't know. So everything is not just on the spiritual level. You need to balance things. Okay. So there are some antibodies that you could even attack sperm in the body. And yes, we are coming to our close. We are coming to our close now. Number 13 is some ulcer drugs. Some ulcer drugs could also result into low sperm count, and studies is still on omeprazole, but for now, omeprazole. I don't think anyone that has issue with fertility should take omeprazole. Study is still ongoing on omeprazole. And my last for today is infections. Yes, infections, inflammation of the testicles, for example, could result into low sperm counts. Sexually transmitted infections. Yes, see a man sleeping about, telling you I'm strong, I'm this, I'm that. Sexually transmitted infections like gonorrhea, STDs, HIV, HIV/AIDS, yes, gonorrhea, generally generally trans sexually transmitted infections. Sexually transmitted infections could result into infection, and that could end up resulting into low sperm count or infertility in men. So does anyone have any question? Do you have any question for me? Like I said, next week we'll be talking about females. Yes, next week we'll be taking time to talk about females. What causes infertility in females? A lot of people just see, oh, that woman has been married 1 year, 2 year, 3 years, 4 years. What exactly is happening? She's not a witch. Some people will say, hey, you don't have a baby after 1 to 3 years, the person is a witch. She's not a witch, okay? You don't really know what is going on in her body. You don't really know what is going on in her body. So they just tag people as a witch because they don't have a baby after 1, 2, 3, or 4 years of getting married. Okay, so thank you so much for coming around. Please endeavor to like the stream, leave your comments behind. If you have any question, you can leave it in the comment section. Share with your friends, share with your families. Share with as many you can share with. Yes, a lot of people are having issues with infertility and they think it's just the woman is the woman. No, both the man and the woman, they are both into it. And don't forget, I said male fertility starts to fall after 40 years. So if you are 40 years, you need to start thinking of getting married. You need to start working on getting married. Okay, super boss, I'm expecting your IV very soon. Well done, host. Keep teaching us on our health. Thank you. Thank you, everyone, for coming around. Thank you, Everyday Matters. Thank you, Joyous Joyce, LES Matters, Super Boss Cake, everyone. Iyangas in Dubai, Yomiti, Oluwaseun, Fantastic, Efe, everyone that came, Ujunwa Chinwe, everyone that came into the chat, and my members, thank you so much. Joyous Joyce, Uzoma, thank you for your support. Thank you, Everyday Matters. And as many that would like to support this channel financially, you could also join the membership in order to be of great support to this channel. So thank you so much for coming around. Happy weekend to you. Happy weekend to your family. Happy weekend to you. Any question for me before I call it a wrap? Yeah, before we call it a day. Any question for me before we call it a day? Thank you for coming around. If you are here to watch that video, please try to watch it. Yes, causes of infertility in men and foods that could also help to tackle infertility. You could also try to watch that video. I'm going to be leaving it at the end of the screen. Okay, it's going to be popping out. Two videos will be popping out at the end of the screen, so endeavor to check on them too. They could be of great importance to you. Thank you for coming around. See you. See you. Ciao, ciao. Ciao, ciao. Ciao tutti. Ciao tutti. Thank you, everyone. Thank you, everyone. And bye bye.